I want to talk about some causes of ED or erectile dysfunction. Erectile dysfunction is actually the inability to achieve or maintain an erection that is adequate enough for intercourse. So there's several different causes or issues that can occur with ED. Vasculogenic causes can attribute about 80% of ED, and these are things like your hypertension, your atherosclerosis, which is the hardening of the arteries, dyslipidemia, which is cholesterol issues. Some guys can have impaired arterial health when these things occur, and so the blood flow to the penis isn't adequate enough for an erection. And there's also the issue where there could be impaired venous health as well, where you're not able to keep the blood in the penis and it's just flowing back out more than it should. I want to talk about some causes of ED or erectile dysfunction. Erectile dysfunction is actually the inability to achieve or maintain, and there's also these psychogenic causes. So if you're having stress, anxiety, depression, marital troubles, and maybe even some financial difficulties, and some guys just in general get performance anxiety. There's also some endocrine issues, so low testosterone being one, diabetes, obesity, issues with something called metabolic syndrome, where you're having some increased fat, you're having increased cholesterol issues, blood sugar problems, and all those things together can cause a problem with the erectile function. Also some anatomic issues like a birth defect, trauma to the area, something called Peyronie's disease, which is scar tissue. There's also medications, and there's over 200 types of prescription medications that can cause ED. There's also neurogenic causes of ED. If you've had a prostatectomy, sometimes the nerves can get affected with the surgical process. Alzheimer's and MS can also cause ED, Parkinson's disease, any brain or spinal cord injuries.